Okay, so my name is Ekman. I'm an orthopedic surgeon. I practice orthopedic sports medicine, and I'm the primary author of this study on the efficacy of Tanezumab in hip and knee osteoarthritis. This particular investigation focuses on efficacy of a nerve growth factor inhibitor, and that's Tanezumab. Tanezumab is a a humanized monoclonal antibody that inhibits nerve growth factor. Nerve growth factor in embryogenesis has some important role. Its role in beyond there certainly is unknown, and in fact in adults we don't think it has any role. So it has been shown to diminish pain, and these two studies look particularly at hip and knee osteoarthritis. These were 16-week trials. They were double-blind, double-dummy. They were pretty significantly large studies. And they also had an active comparator group, and that's naproxen at its therapeutic dose. So in these studies, there were a number of primary endpoints. The essential primary endpoint looked at the WOMAC pain, the WOMAC function subscales, and a patient's global assessment. So the primary endpoint was at 16 weeks. One of the unique things about Tanezumab is it's dosed only once every 8 weeks, at least right now in the development program. It's injected and it's compared to naproxen at 500 milligrams 2 times a day. So our primary endpoints were 16 weeks, as I mentioned, and in these we saw superiority not only over the placebo, but at the 5 milligram dose of Tanezumab, we saw statistical superiority in the patient's WOMAC pain, the WOMAC function, and the patient's global assessment. Also superiority in many of the primary endpoints as well. So, as I mentioned, the molecule is not FDA approved to date. There has been a question raised over the possibility of osteonecrosis, but what we know to date is that in terms of progression to joint replacement surgery, Tanezumab is not different than a traditional anti-inflammatory, or for that matter, a COX-2 specific inhibitor. Using an adjudication committee, there has been only in the entire clinical development program to date, I believe, 1 case of osteonecrosis that's been identified in that committee using bone pathology as well. So I think the future is promising. I'm excited about the molecule and look forward to being able to develop more research.